7-year-old boy who was referred to me because the school didn't know what to do with him. They were just, trying to push him out and having the less time possible in classroom because he was quite disruptive. And they suggested parents that he needed therapy. So he was referred to me for that reason. After 8 months, probably, the mother came to me and said that the school had referred him to a sort of daycare center that was meant to be for children with psychosis diagnosis. And I said, whoa, wait a minute. I don't think this child is psychotic. So I request the person who was my supervisor at that moment at the child abuse program where I was working, it was the only person that I knew that could help me. So I asked her a moment for consultation, and I went to her home on a Saturday and spent almost 5 hours supervising this case. So I told the supervisor that one day, probably 2 months before, this boy came to see me, and when I greeted him, saying his name, he was very serious and said, no, I am not the name, let's say like John, I'm not John. I'm his twin brother, and you never met me before. And I didn't have any sort of experience, so I thought he was kind of teasing me. And I kept saying, no, you are John. And he kept saying, no, I'm his twin brother. I'm always silent. I'm the one who pays attention at school. I always behave well. It's only that I never speak. And he spent performing this twin brother, probably 3-4 sessions. And when I talked about the situation to my supervisor, she said, stop there. And she made me retell all the session, each of these sessions. And she said, you have to read this book. And she went to her bookshelf and brought me a book that had been written by Rick Cleft, which was called Childhood Antecedents of Multiple Personality Disorder. And she said, this is what happens with your patient. This is how I first came into knowing there was something called dissociation. Later on, I reached the International Society for the Study of Trauma and Dissociation, because when I read this book, I said, obviously, this is what happens to this child. And when I started working more and more with patients at the child abuse program, I realized that many other children and adolescents had similar presentations as the one that I have been reading on that book. Back in the 90s, the late 90s, it wasn't like today that you can just Google something, push the button, and have whatever you want. But my supervisor had lived in the United States for 10 years with her family. And when she came back to Argentina, she brought all her library, and she lended so many books that were talking about trauma and childhood trauma that I understood that this was the pathway that was completely different from what I have learned at the university. And this is how I started trying to find more and more resources to understand how to help my patients with their traumatic symptoms and dissociative symptoms. How at the beginning of the new millennium, I became a member of the International Society for the Study of Trauma and Dissociation. Whenever it was possible for me, I traveled to their conferences and presented my work, because my thought was, here, there are the experts. If I show my work to them, they will tell me if I'm doing right or wrong. The journey never ended.